Hello. By now you've heard that we at Inspira, like the rest of the country, have had more demand for vaccine than we had vaccine to fill it. And I wanted to deal with that issue right up front and tell you how very, very sorry I am for the distress that it may have caused those of you who had appointments scheduled. So I know the question is, I trust you with my health care. How could you not count, right? And I hear the frustration, but here's what happens. We anticipated that we would be getting new trays and that we would have plenty of vials to be able to provide the shots. And when we got to the middle of last week, when we actually were able to vaccinate a whole bunch of people, over 5,000 in a week, we realized that without that tray coming and a guarantee of it, we would not be able to give both first and second dose. And our obligation, beyond everything else, is to make sure that we trust the science. We have had this conversation over and over, and when it came time to the hard decision that we would need to cancel people in order to give both first and second doses, we had to. And again, I use the word cancel. It was canceled from the date that you were originally scheduled. We are going to honor every one of those appointments, unless of course you get it somewhere else, which I'm encouraging people, if you can find the vaccine somewhere else, get it as soon as possible, because that is the priority. The Commissioner of Health on Friday reaffirmed to all of us that we must get our second doses where we got our first doses. And so again, if you were in that 13,000 who actually were coming for a second dose, but you had gotten it somewhere else, you will be hearing from the county, and we're trying to work with them to make sure they know, based upon our registration, who you are as well, so we make sure nothing falls through the cracks. I know it's confusing and I know it's frustrating, and I do appreciate those of you that reached out to me over the weekend to raise this up, because there are unintended consequences that happen, so I thank you for doing that. But again, you will get contact and an email from the county or a text message, and you will reschedule with them. They are making appointments available to make sure they honor the second doses. In New Jersey, we have given 522,000 doses of the 721,000 that have been received. And at Inspira, we've given over 11,000 doses to both our community members as well as our employees and our first responders and our physicians in the community. I want to assure you, we want to give them to you as much as you want to get them. And so all we're doing is just waiting for that notice, and then we will immediately begin to contact people via email, via text, and if we miss you through either of those things and we have your number, we'll call you directly. We know that the only way normal happens is when we're doing the things that we've already done and then having this latest opportunity of the vaccine. So we're washing our hands, we're remaining socially distanced, we're wearing our masks, and that has to continue even after you have the vaccine. Because what happens with the vaccine is it affects your immune system and it allows you to be protected, but you may still be carrying and actually give it to someone else. Once we have 70% of our people vaccinated throughout the community, then we'll be able to think about lightening up on some of those areas. But it's really, really important that we stay the course. And I want you to know, it already is clear to me, we are not seeing the same numbers of people coming into our hospitals. It's still high, but not nearly as high as it was the 11 days post-Christmas. And we are so grateful for that. And so we need to continue to do all the things that we normally do. And last week, one of the things that we normally do is continue to bring on new services and new opportunities for you to access Inspira. And I had the privilege of opening the Woolwich site, which has a whole complement of services in it, including our sleep center, including our sports rehab program. And there were people already in the program and doing their rehab. And it was so wonderful to see, even in the middle of all of this other things, that we continue to make progress, continue to ensure the most important thing, which is increasing access to health care for our communities. Even in the middle of all of this, we are still able to keep progress moving. And that's what we have to do for Inspira, for ourselves, for our families, and most importantly, for our communities. I want to thank you for your patience. I promise you I will continue to keep you updated, both through our advertorial as well as through this mechanism. And again, until we meet again, be well and stay safe.